Hello, this is Dr. Khushboo Asrani. I'm a practicing pediatric neurologist at Asrani's Clinic, Jabalpur. So today we'll talk about what is epilepsy, what is seizure, and how do I know if I have epilepsy. Seizure is a single isolated episode of disrupted electrical activity in the brain, which presents as stiffening of limbs or tightening of limbs, staring episodes with or without loss of consciousness. So, to better discuss, it is actually a single isolated event, and a seizure can happen due to a variety of causes. For example, high grade fever, low sugar, low blood pressure, or in case of head injury, low sodium, or maybe different reasons. A single seizure cannot be labeled as epilepsy, which in fact is a condition, a neurological condition where a person is at risk of having recurrent seizures. So, a seizure may need acute treatment, but it does not require a long term treatment. On the other hand, epilepsy usually needs long term medications. In simple language, epilepsy is termed as seizure disorder or मिर्गी की बीमारी. Now, how do I know if I have epilepsy? If a person has had two or more unprovoked seizure more than 24 hours apart, he is more likely to have epilepsy. Now, what does this unprovoked means? If there are no common underlying causes of the seizure, for example, fever, low sugar, low blood pressure, low sodium, or head injury, so there's no obvious underlying reason for the seizure, and he has had two or more seizures which are at least 1 day apart, he is likely to have epilepsy. However, for diagnosis, you need to visit a neurologist to know whether or not you have epilepsy, and you need to start medications or not. For diagnosis is usually clinical, but he might do a set of investigations such as EEG and MRI, which are needed for the confirmation of diagnosis and, more importantly, to know the type of epilepsy and underlying cause. Epilepsy is a treatable entity, so if timely intervention is done and regular medications are taken, they can have very good quality of life without having recurrent episodes. Thank you.